The first time I ever reached out for help was to a VA facility. My PTSD was discovered by a psychologist. They talked with me, not at me. The treatment was slowly improving my mental perspective. Certain things were less stressful if I follow a procedure that was recommended by our healthcare professionals.
There was one-on-one therapy involved, there was CBT, of course, there was writing therapy. The cognitive behavioral aspect of it led me to understand my triggers. It led me to understand where I had gotten sidetracked and gave me a path through it, through self-evaluation, through group discussion, where I could really bring it out into the open and deal with it for the first time in my entire life.
The year-long rehab program that I was in was high intensity as far as when you were going through the alcohol recovery program. When you get in and you get into one of their programs, they really take interest in you, and they really are concerned about what you're about to go through. There are people out there that devote their lives to service of other human beings. All three of my children talk to me now. We talk at least once a week to each other. It means everything in the world to me. I have my family back.
When I got treatment at Cape Canaveral and was diagnosed with general anxiety disorder, the doctor offered me a couple of different options for treatment. One of the treatments the doctor offered was cognitive behavioral therapy, CBT. Another he offered me was a prescription drug called Lexapro. Deciding at the time that frequent treatments in person for CBT would be difficult with my job as a commander, I opted to go with medicine. And I was so impressed how 2 or 3 months later, my wife came up to me and said, "Honey, I've noticed such a difference." And again, it happened so slow, and I just think I haven't changed. But it's the people around you, the people who are most affected by my mental health, who are noticing the differences.
They got me started on something called EMDR. The main way to do it is they'll hold something up and you'll talk about your troubling past, like that soldier that died, and you'll have to follow it with your eye while you're talking it. And it helps regulate your right side and your left side of the brain while you're doing it. And what works best for me is I'll just go and all people think I'm crossing my arm and I'm tapping both sides while I'm talking about it. And usually I'm like this and people think I'm just pissed off, but it's how I deal with troubling situations to this day now.
Group therapy is great because if somebody's thinking a certain way, another person may see another way to problem solve.
Just the things that treatment has taught me through the VA on how to handle my anxiety and my fear and understand why I did the things I did. I don't know, the VA, I can't say enough for the treatment that they've offered, inpatient as well as the outpatient programs that I'm still in and will continue to be in until I feel comfortable leaving.
So after that first visit, once you get a chance to sit down with a therapist and realize all they want to do is help. They want to listen to what's going on in your life. They want to tell you this is not exceptional, this happens to a lot of people, and they want to offer you solutions to help.
There are legitimate ways to heal, and there are people out there who genuinely care and will listen and help you. It's really an awakening experience, so allow yourself to be awakened.